And now the SMX medical update. We bring Dr. Joe McGinley of the McGinley Clinic back. Well, we had spent a lot of time on this show talking thumb injuries this year. Maybe we talked too much because Jet Lawrence made it look pretty easy to bounce back from a thumb injury. How do you think he was able to do this quickly, Joe?
Well, it was impressive. Again, thumbs have been the topic all summer long that we've been chatting about. And, two of the major injuries, Tomac and Lawrence, they were up front battling the entire time. So they've recovered, that's for sure. It was impressive to see Jet out there racing as hard as he was for the amount of time he had to recover and get off the bike. But, if you heard some of his interviews, he was doing all the right stuff. He was in physio twice a day. He was really pushing the edge as far as recovery and aggressiveness. But the other important point is these injuries aren't all exactly the same. With Cooper Webb, with Eli Tomac, with Jet Lawrence, they're all slight variations on this particular injury. And depending what you had done, what the approach was on the surgical repair versus non-surgical, and how you manage it afterwards, that's where you're seeing the difference.
Well, talking about the other riders that weren't able to race this weekend, namely Jason Anderson, Justin Barcia, Nate Thrasher, assuming they're going to try to get back onto the racetrack this upcoming weekend in Fort Worth, how do you approach that? Is it, we hear these words thrown around, recovery versus active recovery, and then you just think about the pure rest, trying to heal up too. What do you think the best approach is, big picture, for something like that is not a structural problem? They're certainly in pain, but they know they need to be their best self this coming Saturday.
Yeah, I mean, they're all going to be sore, right? That's just part of the sport. But the biggest thing is you touched on there was just making sure there's nothing structural. So making sure you get x-rays and MRIs if needed, and making sure that the problem is clearly identified. If it's bruising, hematomas, stresses of the muscles or bones, those are things that you can recover from during the week. It might not feel good, when you get there to Friday, Saturday for the races, but these guys are pro athletes, they're elite athletes. They'll be able to push through it and get back out there. So yeah, this week's going to be about recovery. It's about decreasing the inflammation, making sure that these areas are identified and that the anti-inflammatory treatments are in place to decrease the swelling, decrease that irritation of those tissues. And then hopefully they'll get some time on the bike towards the end of the week, make sure they feel good and are confident and comfortable on the bike before they get to the starting line.
All right, we'll definitely have our eyes on them, and we'll see you next week.